But what would you say if someone asked you about the root causes of the pandemic that swept across the globe? Or what steps could have been taken to prevent the spread? Today we delve into these questions, unraveling the causes and precautions of the pandemic in chronological order. Let's rewind to the beginning. The pandemic, known as COVID-19, originated from a novel strain of coronavirus. This virus, first identified in the city of Wuhan, China, in late 2019, was traced back to a seafood market with live wildlife. The exact animal species that transmitted the virus to humans remains under investigation, but what we do know is that human activities played a significant role in its emergence. Deforestation, urbanization, and the illegal wildlife trade have all been cited as major factors, as they bring humans into closer contact with wildlife, creating a hotbed for zoonotic diseases. The virus spreads primarily through droplets produced when an infected person coughs, sneezes, talks, or breathes. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. Contact with contaminated surfaces followed by touching the face can also lead to infection. Now, let's talk about precautions. Early detection is crucial in controlling the spread of the virus. This is where testing comes in. Regular and widespread testing can help identify infected individuals, who can then be isolated to prevent further transmission. Wearing masks is another key precaution. Masks serve as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people. Hand hygiene is equally important. Regular hand washing with soap and water for at least 20 seconds can kill the virus if it's on your hands. If soap and water are not readily available, a hand sanitizer containing at least 60% alcohol can be used. Physical distancing is another vital precaution. Keeping a safe distance from others, especially those who are coughing, sneezing, or not wearing a mask, can reduce the risk of infection. Finally, vaccination plays a crucial role in curbing the pandemic. Vaccines work by training the immune system to recognize and combat pathogens. They significantly reduce the risk of severe disease, hospitalization, and death. To summarize, the pandemic was caused by a novel coronavirus, likely transmitted to humans through wildlife due to human activities. The virus spreads mainly through respiratory droplets and contact with contaminated surfaces. Precautions include regular testing, wearing masks, hand hygiene, physical distancing, and vaccination. Understanding these causes and precautions is not just about looking back, but also about moving forward. It's about learning from our experiences to better prepare for future health crises. After all, knowledge is our best defense against the unseen enemies that lurk in the shadows of our modern world.